Hey everyone, this is Dr. Mark Boyd. I'm a board-certified obstetrician gynecologist. I've been involved in women's health care for the past 25 plus years. Many of the questions and concerns that women have as they've come into the office over the many years, I'm hoping to address on my YouTube channel as I move forward. And if you have comments, I encourage you to comment below. Our topic today is prenatal vitamins. Now, this is one of the many questions that women address when they come in to see me for the first time. However, many of those women are already pregnant, and those questions really need to be addressed prior to conception. Approximately 50% of all pregnancies in the United States are unplanned. Now, that doesn't mean they're unwanted, they're just unplanned. So obviously that group of women is multiple weeks into their pregnancy before they start prenatal vitamins. So I encourage you as a patient to consider planning your pregnancy and then get started on prenatal vitamins prior to conception. Now there's 5 elements in prenatal vitamins that I think are very important. Now there's other elements as well, but I'm going to address 5 that I think are very important for you as a patient. 3 of the 5 deal directly with fetal development, that means baby development, and then 2 of the issues are more for the patient, meaning you as the person that's taking the vitamins. The first item that needs to be in all prenatal vitamins is folic acid or folate. Now the amount that's recommended is 400 to 800 mcg. That stands for micrograms. Folic acid is important in the development of the baby's brain and spinal system. That needs to be taken prior to conception. The second element is also important for the baby, and that second element is iodine. Iodine needs to be taken in the amount of 150 micrograms, that's mcg, on a daily basis. Now iodine is also important in the baby's brain development, but it's also important for the mother later in pregnancy. As you develop into your pregnancy, you'll have increased stress on your thyroid gland. Your thyroid gland is a gland in the neck. If you don't consume enough iodine, your thyroid can't function, and you're at increased risk for preterm labor, for miscarriage, and for babies dying inside. It's called stillbirth. The third item that's very important in your prenatal vitamin is called choline. It needs to be consumed in the amount of 400 to 450 mcg on a daily basis. Now choline can be taken in many of the foods that you eat, eggs, liver, legumes, but oftentimes women don't get enough of that and they need that in their prenatal vitamin. The fourth item that needs to be in your prenatal vitamin is vitamin D. Oftentimes, especially in women that live north of the Mason-Dixon line, don't get enough sun in their daily activity. Sun is very important in vitamin D absorption in the body. So vitamin D needs to be replaced. You need somewhere in the neighborhood of 1,000 international units per day. However, recent studies show that you probably need 4,000 international units per day. The fifth item is iron. Now, iron is important in your blood, transferring oxygen to your body. Now, those 5 items are very important to consume on a daily basis. I've identified one multivitamin, one prenatal vitamin, that is very good, and it's called Mega Food Baby and Me. Mega Food Baby and Me. And they make a version 2, but I prefer the Mega Food Baby and Me. It has all of the elements that we talked about, except it doesn't have quite enough choline. It has 300 mcg of choline per day, and you need 400 to 450. And again, how do you get that extra 150? You eat eggs. In fact, if you ate 3 eggs a day, you wouldn't need choline. Each egg has approximately 150 mcg, micrograms of choline per day. So if you take your prenatal vitamin and eat 1 egg per day, you're going to get enough choline. The other beautiful thing about Mega Food Baby and Me, it also has herbs in it that will help in the digestive process. Many times women take prenatal vitamins, it causes nausea, and they therefore don't want to take the vitamin. So it has several herbs in it, one specifically called ginger that oftentimes will help with the nausea. Now there is a second vitamin that I do recommend if you can't get the Mega Food Baby and Me, and that's called pink stork. Now it comes in a tablet form and a liquid form. I recommend the tablet form because it has enough folic acid, it has enough iodine. It only has about 18 micrograms of choline, so it's far short of the necessary needs for choline. It has enough vitamin D and it has enough iron. But I really recommend, if you're going to take Pink Stork, that you take the tablet, because the liquid only has about 100 mcg of your iodine, so it doesn't have enough iodine. Again, these are guidelines that I recommend. You can talk to your healthcare provider. I encourage you to take these on a daily basis. Please visit my channel as we move forward with other women's healthcare issues. Look forward to seeing you then.